Cammy, how are you?
Good, how are you?
I'm good. I'm here for patient Chanel for that cranie. I just wanted to go over some stuff.
Yeah, so I don't think she has any allergies. We didn't do an HCG, but she's older than 10, but I think she's not sexually active, so she
Okay, that's probably fine. We don't need to do that, I don't think. Our consent signed?
I signed it, but parents haven't signed it yet.
Okay, and it loocut like, I don't think Dr. Honeycutt signed it yet, but I can just ask him to sign it back in the room. That's probably fine.
Okay.
Krista, do you have anything?
Hold on, let me finish this crumble cookie order.
Okay. Let's see.
Okay. No, warning
Any
considerations.
blood-
No, none of this is important. We're good.
Okay, I don't really, blood products, I haven't checked that, but we can just check that when we get in the room probably.
Yeah, that's fine.
Okay. Do you have any worries, any concerns? Is the patient okay?
Yeah,
I haven't
she's
looked at an
good.
H&P or anything, but
Yeah, she's fine. She's good.
okay.
Mom's in there, though.
Everything normal with them?
Yeah.
Okay. Sounds good. Okay, we'll go in and talk to him. You ready?
Ready.
Hi, my name's Megan. I'm the nurse that's going to be taking care of your kiddo during surgery today. I've just got a few questions for you. Does she have any bands on her hands or feet?
No, it doesn't look like it.
I have them on the front of the chart, so you can just go back with them on the front.
Okay, perfect. Okay, perfect. Can you just tell me her name and birthday?
Yeah, this is Chanel. Her birthday is 3/8/2016.
Perfect. Is she allergic to anything that you know of?
Nope, not that we know of.
Okay, and when was the last time she had anything to eat or drink?
It was, I think, this morning.
Okay, perfect. Do you know what time?
Maybe like 2 a.m.?
Okay, sounds good. And does she have any metal anywhere on her body?
No, I don't believe so.
Perfect. And what procedure are we doing for her today?
We are doing a craniotomy.
Perfect. Other than that, do you have any worries about anything like her laying on her arms or legs or anything like that back in the OR? Like for a long period of time, does that make sense or anything like that?
Sure, that really hasn't been discussed with me that much.
Like she'll be laying back there for a while, so do you have any worries about her being on her extremities for a long period of time, or like we can't do blood pressures or anything like that on her arms or legs?
If you don't know what she's talking
Yeah.
about, it's probably
It's
fine.
not a big deal.
Okay.
Don't worry about it.
Okay.
Or let's see, what else? Did we do a lice check? That's probably not that important.
I think we're good.
Okay.
Did we need to take the metal off of her necklace?
We can do that right before we go back. That's not a huge deal. Other than that, does she have anything that you want her to go back with, like a toy or anything like that?
Oh, yeah, she has her favorite blanket in the car that really comforts her. She doesn't go anywhere without it.
Oh, well, I guess we can wait to roll back. If you want to go grab it before we leave, we can go grab that. We can always do that. So.
Yes.
And then, do you have any questions, Krista?
I'm Krista, by the way. I'm your nurse anesthetist. You
Oh.
already talked to Dr. Gelber? Could you understand what he was saying? Any questions or anything like that?
No,
Okay.
no, I don't think so.
Okay. Any problems with anesthesia in the past?
No, I
Okay.
don't think so.
And let me look at your airway real quick. Open your mouth as wide as you can. Oh, it's fine. We'll do it later. That's fine.
Okay.
Yeah.
Okay.
I think we're good.
Okay. Well, if you want to give hugs and kisses, Mom, we'll be ready to go here in just a minute, okay?
Oh, okay. All right. That was fast.
We'll make sure that you don't have any questions or concerns. We'll go double check everything and then we'll get going, okay?
Okay. Okay, that sounds good. Thank you.
You're welcome. Okay, we'll be back in just a second.
All right, baby.
Call Cammy Bjorklund. Hey Cammy, we're here for room 37. Just wanted to let you know if you can come over for our pre-op checklist. Hey, perfect.
Pull up her chart.
Okay, perfect.
All right, so this is Chanel. She's got no allergies. She's 9 years old. Mom's in the room, but is hard of hearing, but I marked that on the front of the chart, so on a big
Okay.
pink sticker.
I'll make sure to put it on here too. That way we can pass it along to PACU and stuff.
Okay. Here's our consent. It's all good. H&P is done.
Awesome. Consent signed, H&P done.
Lice check is good.
Perfect. Let's see, and how's her HCG?
HCG was negative, and it's right here.
Perfect, okay. And then I see preferred name and pronoun Chanel and she. Okay, and then we've got all our required equipment available in the room. I checked on blood products. Do you want those in the room before we roll back?
Yeah, let's have them in the room.
Okay, sounds good. I'll get that done before we roll back. And then let's see. Anything for you here, Krista?
Warming considerations, difficult IV stick last time, so I have the room pretty toasty. Prayer hanger and our warming lights out.
Okay.
I looked at the labs, everything looked normal. I looked at the screening form on the PAA tab for DVT prophylaxis, not indicated, so we don't need STDs.
Sounds good. Okay, perfect. Other than that, I think we're good, so we can go ahead and go in and say hi to Mom and Chanel and get rolling.
Thanks, Cammy.
Sounds good. Thank you. Hi, Chanel. My name's Megan. I'm going to be the nurse taking care of you during your surgery today.
My name's Krista. I'll be the nurse anesthetist.
Hi, nice to meet you.
Nice to meet you.
Are you Mom?
Yes, I am.
Nice to meet you.
Nice to meet you.
We've just got a quick timeout that we're going to do all together with all three of us here just to make sure that we're all on the same page before we go back for surgery, okay?
Okay.
Okay. She looks real tired, but we're going to just ask a few questions and then we'll get going, okay?
Okay.
Okay. I'm going to look at her bracelet and can you tell me her name and birthday?
Yeah, her name is Chanel, and her birthday is 3/23/12.
Perfect. And is she allergic to anything that we know of?
No.
Okay. And when was the last time she had anything to eat or drink?
Last night at 8 p.m.
Perfect. And any metal implants anywhere in her body?
Yeah, she actually has a metal plate in her back knee.
Oh, okay, perfect.
Mhm.
Awesome. Thank you for telling us.
Yes.
And then what procedure are we doing today?
A craniotomy.
Awesome. Okay. Did you have any questions for Dr. Honeycutt or anything?
No, I think everything was explained well. Thank you.
Perfect. Okay. Let's see. We already did our lice check. And then did Cammie get you signed up for text message alerts?
Yes, thank
Okay,
you.
Sounds good. So we'll be texting you at the beginning of the case, every hour to hour and a half after that. And then once we're finishing up, that way you can make sure you're in the waiting room to talk to Dr. Honeycutt, okay?
Okay, great. Thank you.
And then any home medical devices that she uses at home, any like braces, crutches, anything like that?
Yeah. No, not that I'm aware of, no.
Okay, sounds good. And then it looks like, does she have a lovey that we're gonna go back with?
Yes, this is her stuffed animal. She doesn't go anywhere without it.
Okay, perfect. Well, we'll make sure that that gets back with her through recovery and throughout the whole operation and all that stuff, okay?
Hey, thank you.
Okie doke. And then do you have any concerns about any of her arms or legs that we can't do blood pressures on or that she can't lay on a certain way?
Nope, I think we're good.
Okay, sounds good.
Bless
Well,
you.
I'll pass this off to Krista and I'll let her ask her questions.
Okay.
Just a few questions we like to ask to make sure we have a good anesthesia plan for Chanel today. I saw she's had anesthesia in the past.
Yes.
Any issues with anesthesia? Did you wake up okay?
Yes, thank you for asking. That reminds me that the last time she had anesthesia, she just could not quit throwing up after it. She was really sick for a while.
Okay, good to know. I didn't see
Yes.
that in the chart, so that's definitely something we can kind of change how we do things a little bit
Okay.
and see if we can prevent that from happening this time.
Wonderful, thank you.
Was okay after a couple of doses of medications to help with nausea and vomiting?
Yes,
Okay, so didn't have to
yes.
stay longer because of it or anything like that?
No.
Awesome. Let's see. Taking any Tylenol or Motrin in the last 24 hours at home?
Nope.
Okay. Let's see. Any medications that we've taken at home in the last 24 hours at all?
No.
Okay, perfect. And I'm just going to assess her airway real quick. Chanel, if you'll open your mouth as wide as you can and stick out that tongue. That's perfect. That's a perfect airway. No loose teeth, anything missing, chipped, anything like that?
You know what? She does have a loose tooth right back here that she might lose soon.
Okay, so it's very wiggly.
Mhm,
Awesome.
mhm.
I'll probably give it a little wiggle when we get back to the room before we go to sleep.
Okay, good deal.
And you said she woke up a little crazy last time, so we have some medications that we can use to kind of calm that down this time as well.
Okay, awesome. Thank you.
Any other questions about anesthesia or anything like that for me?
No, I
Okay.
think all my questions have been answered. Thank you.
Awesome.
Perfect. Well, we'll get going here soon. If you want to give hugs and kisses, say see you later. We'll make sure our team's ready in the back and we'll get going, okay?
All right, sounds good.
Okie doke.
All right, Chanel.